Hi, this is Mr. H, and I want to thank the Hot 120 staff for bringing me out to talk about the hot topics and just inform the people on different things that are happening. Today, we want to talk about the coronavirus and its impact on Black people. Um, this coronavirus has emerged from Wuhan, China. Um, Based on all the research, it says that the Chinese government might have known about this since December. Yet we're in March now, right? That's another show for another time. But the question is, how does it impact Black people? As of today, which is March the 9th, 2020, I have not seen one case um, or heard, I have not seen or have not heard one case reported about a Black person having the corona virus. So that uh, opens up a big question. How is it impacting the Black community? Yeah, I understand there's a case, two cases in South Africa, no deaths. There might be two cases in Nigeria, no deaths. Uh, Tanzania, I believe, no two cases, and even Morocco might have two cases. Um, those are African countries. Um, but you got to also understand that everybody in those countries are not just Black people. That you have Asian, Caucasian, and foreigners there too. So just because they have two reported cases doesn't mean that it was from somebody from that's indigenous to those continents in those countries. Um, Again, I haven't heard of or seen on the news any cases of any Black people having the virus. So, with that being said, what is the impact? Well, I'm not here to say that Black people cannot catch the virus, right? That would be a stupid comment. But when I put on my epidemiology hat and think about how rapid the disease is spreading across the globe, I would think by now there would be a documented case among somebody that is Black. Maybe it has happened, but it has yet to be reported. Um, I have not come across anybody with the coronavirus that I know of. Now, should Blacks be afraid? No. The first thing to destroy your immune system or weaken your immune system is fear and stress. So you cannot be afraid. Cannot be operating in fear, cannot be acting foolish off of fear. You cannot be acting foolish because social media is saying things, the news saying things, the president saying things, and everybody saying inconsistent things, including from the CDC and the White House, including between Trump and Pence. Two different messages. Trump saying that there's enough kits, and others are saying that there are not enough kits. So that creates panic and that creates fear. So should Black people fear? No, not at all. But you got to be cautious. Okay. So what do you mean by that? There's some preliminary steps that you have to take. Do you have to go? Uh, um, do you have to go crazy with it and try to buy every bottle of sanitized lotions and hand wash? No, no. You got to learn, you got to do some research and learn more about the disease. Okay. So you got to do what you normally do. You just got to do more of it. So you got to wash your hands as much as possible and be mindful not to put your hands in your mouth, in your eyes, or in your ear or in your nose. These are gateways into your body. Now, some saying it's airborne. Well, if it was airborne, then more people would have it than the numbers that have it. Okay. Let me say that again. If it was airborne, if it was one of them airborne things, then more people would have it than the numbers that have it. This is a virus that has to be carried. What I mean by that, the vehicle is your hand. Say the vector would be, all right, this, I'll just put my public health hat on. The vector would be where the virus sits, right? Where it sits. The vehicle is how the virus is transmitted or transported, okay? So the vector could be a dining room table, a table at work, an office at work, a doorknob, right? Your hand touched that, you're touching the vector, and now the virus is traveling on you, right? And then you put your hand in your mouth, on your nose, on your eyes and ears, and now the virus finds a way into the body, okay? Now, this virus is smart, so it's mutating because it has made a leap from, based on some research, they're connecting these coronaviruses to bats, surviving in bats, but now it has made a leap into humans. So the virus is trying to survive. We, okay, have a chance to crush its survival if we continue to do the hygiene things, washing the hands, right? Washing the hands more than 7, 8 times a day, whatever number, wash them as often. And I even say, and I haven't heard anybody say this yet, but I'm a thinker, I think you need to wash your face too, as well. Wash your face several times a day, you know. That would help in case you touch the surface and touch your mouth or whatever. Wash your face several times a day as well. Make sure that none of the viruses on your face, and you don't want your face to become a vector as well. And then from your face, you touch your cheek or something and touch your mouth, and now you have the virus. So no need to be afraid. There are things we can do. And also, those people that are healthy, like, you know, work out and not really sickly people, don't have any underlying or pre-existing conditions, they can recover from this virus. So there's documentation that some have recovered from the virus after being quarantined. Okay. So you say, well, what's the impact on black people? Again, I haven't seen a reported case. This is why I'm saying, does it impact us? You know, is it something in our DNA? Is it something in our biological makeup that's causing this disease problems in reference to infecting us? That's a question I'm putting out there. It'd be interesting to hear comments, feedback on that. I'm not saying that black people cannot get this disease. What I'm saying that as it has spread rapidly, okay, and China having footholds in African countries because of building roads and airports and commerce, I have not seen it show up in African countries the way I think it would have, based on how we style African countries of not having decent and poor, decent healthcare and health systems. You would think in that situation that this disease would just be rapid in those countries. Now, again, might not be documentation. I just know it has not been reported. That's what I'm saying. Now, the other thing is, this is the only thing that should justify your fear in reference to that. And I'm not talking about stock market fear. People panicking, stocks are crashing. I was on the stock market earlier today, and I got a message saying if a stock does this type of drop, they're going to close the market. So they're trying to save people from losing money because of this fear. But coronavirus cannot do anything to the money. That is fear causing people to panic. And as a result, the market is sort of crashing right now. Okay. Again, I was on the market earlier, and I got a message right across my account saying if the market dropped to a such and such, they was going to close the market down. That was early this morning. So they had paused it, but they were going to close it down for the day if it was going to fall any further. So this disease has a global reach and is impacting the economy based on people's fear. Now, should you be concerned? Yes. Now, before you go out and buy this biohazard suit, okay, and come home and scare your kids half to death, you need to know some things. What makes this disease, this virus, dangerous is not the symptoms. Again, people can recover from the symptoms: diarrhea, respiratory problem with breathing, pneumonia. You can recover from that. What makes it dangerous is the 14 days you can go without symptoms. Let me say that. What makes it dangerous is the 14 days you can go without symptoms. What that means is you can have the virus, okay, and then go 14 days without no symptoms and spread it to your family and spread it to other people without even knowing. That's what makes it dangerous. So if you're going to be afraid of anything, that's where the fear would be. Not, oh, I'm going to get it, I'm going to die. Okay? No, I got it, maybe, or I have it and I don't know I have it. That's the fear. So you say, what do you do? Well, what I'm saying is this. Do everything that the CDC is telling you to do, but do it a little more than what they do it a little bit more than how they're telling you to do it. What do you mean? If they say quarantine for 14 days, do it. But don't just do it one time. Quarantine for 14 days, go 10 days, and then quarantine for 14 days. Do that all year until they get the proper treatment or proper vaccine for it. What do you mean? Well, you may find out that somebody around you have it. Quarantine yourself for 14 days. If you don't see no symptoms, you don't have it. Go back out, socialize, do what you got to do. Mark it down, come back, quarantine yourself for 14 days. This is a way that you can track whether you have this virus or not. You know, if you're used to inviting people over to your house every day, don't invite them every 14 days. Okay? Continue to wash your hands. If you would wash them 8 times a day, now wash them, 15 times a day. Okay? And if you was a social person going out to social events, instead of going to 5 social events, you may go to 1 social event. What you cannot do is live in fear. Okay? So we know a little bit, now we know a few more things about this disease. Now, they also saying that there's another strand in this coronavirus, but I don't think black people need to be concerned about that. It will play itself out. Again, everything fights to survive, so the virus is fighting to survive. But what you need to understand, a little backdrop history, coronaviruses are not new. Anybody remember SARS, severe acute respiratory syndrome? Remember SARS? Huh? Remember that was spreading throughout the world? And now you don't hear much about it. Does it still exist? Hey, chances are, yeah. But they were able to get the vaccine. They were able to contain it. Remember MERS, the Middle Eastern respiratory syndrome. Hit Saudi Arabia in 2012. Boom! People were dying. Did you know that they were coronaviruses? And they were in the CDC and the WHO, the World Health Organization, they were all able to track it to where it was and be able to contain it. So this comes out of the same family of coronaviruses. What has happened, though, the virus has gotten smart and is better able to disguise itself for a longer period. We can learn a lot from the virus. We can learn a lot from the virus. So I don't think black people should be afraid. Again, I have not seen one reported case on the news from anybody, news reporter, social media, anywhere of a black person with the disease. Now, I've heard of cases in countries that are predominantly black, but that doesn't mean that the person in those countries is black who has the disease. I just put the question out there because I think by now I should have saw, not that I want black people to get the coronavirus, but I'm thinking by now there should be one reported case among black people, and I have not seen that yet. And if you have evidence of that, not saying South Africa has two, I already said that, not saying Nigeria has two, I already said that. Do you have evidence of a face, of a soundbite, of an interview, something that shows that a black person has contracted or has been infected with the coronavirus? So at that point, like I said, don't be afraid. Be diligent in your hygienes. And if you don't feel safe with that, just quarantine yourself every other 14 days. Go 14 days, quarantine. Then go 14 days out and about, and then go 14 days quarantine. Again, this is Mr. H. I'm just discussing the hot topics. Okay, I'm just putting it out there. Again, we try to bring you the best material, not no clickbait stuff. Click on us. Everything we do research on it. I might put it in a special spin, but I do ample research to talk about these topics. The coronavirus and its impact on black people, and should black people be afraid? I don't think anyone should be afraid. I don't think black people should be afraid. And again, I'm just waiting for a documented case among a black person. And if they are, and if the numbers are low among black people, then is it something in our biological makeup, DNA or whatever, that makes us less susceptible to these coronaviruses? It'd be interesting to hear your comments. It'd be interesting for you to post some research. Please subscribe to our channel. Hit the bell so you can be notified every time we post new content. Until the next time, be strong, be diligent, be prosperous. And I want to thank the Hot 120 staff for inviting me out to discuss these topics.